Hello, everyone. This is Paula Harris, and I have Dr. Glenda Owen with me from Houston, Texas. How are you this morning, Dr. Owen?
I'm doing great, thanks.
Awesome. Well, I'm thrilled to have you on the call. You've done this before, and longtime client, dear friend, actually. I consider you a dear friend.
Yeah.
You've done some amazing things in your practice, and now the last few years, you've really been supporting other dentists, like on the board with Pankey, and some awards you've received. And what we're going to talk about today is ethics. And you've actually given some presentations to the dental school and also a new dentist committee. So tell us about what you've been doing with that.
Well, I was asked to do a presentation on ethics based on what I had presented at the dental school. And so, interestingly, my husband, who's a lawyer, has been going around the state of Texas giving presentations with a group on ethics for lawyers.
That's right. He's doing some great things with that.
So I've learned a lot from him as well, and so I have put together a presentation that's about how a lot of the current research applies to what happens with us in dentistry. I mean, we're all people, and we all, regardless of our careers or our professions, we all are faced with a lot of similar kinds of decisions regarding ethics. So that's what I have put together, and it's really been fun. Some of these are concepts that people haven't really thought about before. So
yeah. So
unfortunately,
that's the case.
I know exactly.
Yeah.
Exactly.
So, do you have like an outline of what you present and how you talk about that?
Yeah, I do. So, and so what I want to talk about, there's ethical dilemmas that we deal with in our practices regarding patient care, office policies, professional relationships. And then I'm going to move into talking a little bit about our brains on ethics, what psychologists say about ethical decision making, which is really pretty interesting. And then I also like to talk about why do patients leave your practice, and what can you do about that? Mm-hmm. And then how do you develop a practice that attracts and retains patients? Mm-hmm. All of that's really important to all of us. So, so let's start with some of the ethical dilemmas that we face in our offices. Particularly, let's start with patient care. One of the examples that I give is something that we've probably all had something similar to this happen. Let's say you've got a 15-year-old boy comes in with his mother. Mm-hmm. He has decay and an apical lesion on tooth number 19. Father's not present. He's at work. And after you quote a fee for doing a root canal, the mother, who's obviously very concerned about the cost, asks the boy if he wants a root canal or just pull it. And, of course, he replies, just pull it, having heard awful things about root canals, no doubt. And so this tooth is of particular importance because he has an anterior open bite, and he occludes when he closes only on his molars. So losing this tooth is going to be a pretty big deal. So after you explain the importance of all that, the mother shares her negative root canal experience as a friend, and then talks about concern about the fee again and says, let's just pull it. So my question to the group is, what would you do? So those are real problems that we struggle with. Yes. And a little later in our conversation today, we'll talk about what goes into making those kinds of decisions, how you arrive at the right decision for yourself. Then we have office policy dilemmas, and this was one that actually occurred in my office. And what happened was one of my front desk folks mistakenly marked a pre-estimate form as a completed procedure claim. So the patient called us to say that, hey, I got this check for $400 from the insurance company. What should I do with it? So the the business office team member, who's a new person to our practice, suggested that we just go ahead with the procedure since they've already been paid for, and says that if there's a possibility that if we return the check, the patient's records are going to be messed up forever, and the insurance company will continue to say that the procedure has already been done. So how do you manage that? And then the last one is a professional relations dilemma. Let's say you work in a small town of, there may be 12 dentists and a few specialists, and the last few months you've had several patients come into your office complaining about care that they've received from one of your colleagues. And you've kind of noticed he's getting older and the quality of his care has been steadily declining for a few years. And you've been approached by one of the specialists who's also noticed this problem. Now, the doctor seems to have no intention of retiring. So what do you do? How do you handle that? Wow. So those are some of the things that we're faced with in our offices, and you may not think of them as being ethical questions, but they really are.
They really are, absolutely. Those are 3 tough situations.
That's exactly right.
I'm glad you have all the answers.
Yeah. Wish I did.
Yeah.
So then I also like to do just a quick little quiz for everybody. Question number 1, and these are true false. I have a solid, well-considered set of ethical beliefs that can be changed only by reasoned arguments or new evidence. That's question number 1. Question number 2, I have character and integrity that will carry me through difficult situations and hard choices.
That's good.
Yeah. So here's the good news and the bad news about that. The good news is we're not as unethical as we could be. The bad news is we're not as ethical as we think we are. So recently there's a book written by Michael Lewis. You may remember him from Moneyball, which was the book about the Oakland A's baseball team and how they hired a real nerdy guy who used computer analytics to evaluate players that they were scouting and about how to hire them, and it completely changed the landscape in baseball about how scouting and recruiting is done. Well, he has written a book called The Undoing Project, and it's about 40 years ago. There was some studies done by Daniel Kahneman. You may remember him from a book he wrote called Thinking Fast and Slow. He and a guy named Amos Tversky did some research that showed the ways that human beings, the human mind really, systematically err when forced to make judgments in really uncertain situations. And this really created the field of behavior economics, completely revolutionized the big data studies. Applying to us, it advanced evidence-based medicine, which I have to admit, sometimes I have some real problems when it starts being applied to dentistry. And it also led to a new approach about how government regulation is done. So the book, again, is called The Undoing Project, and it's really kind of fascinating, by Michael Lewis. And so what he talks about is the tricks that our brains can play on us. There's auditory illusions. You can go on YouTube or just Google this, and it's called the McGurk, McGurk, the McGurk effect. And what it is it's a BBC clip, and you'll see this man saying ba, ba, ba with a B, and then they change the visual to an F. So he's saying, it looks like he's saying fa, but the sound never changes. It's really fascinating how there's a conflict between what you see and what you hear. And so that's a great example of what happens with your brain. And then there's a lot of optical illusions. There's the famous shepherd's table illusion where you have, it's the um, same size table, but depending on how you have it horizontally or vertically placed, there's all kinds of these that you can find on the internet.
Oh, yeah.
You know, how your brain um, affects how you see things. So the fact is, the mind can fool you. Auditory, optical. There's even a tactile one that they show where you have a person with their arm on a glass table. So they have their arm, and then they have a rubber arm beside one another on top of the table. They have their own arm underneath. But if you go and prick the rubber arm, they jump because they assume that, even though they can't feel it, they anticipate it.
Yeah.
So the mind can really fool you, and this extends into moral sense as well. So one of the overwhelming findings about behavioral ethics is that most of us think of ourselves as being really good people while simultaneously maybe doing some bad things. So why do we make bad decisions? One of these this makes me think about young dentists who are working in clinical situations, working for big clinics, is obedience to authority. And so people have a tendency to try to please those that are in charge. Of course, your job kind of depends on it. And I personally have some real concerns as I see young people coming out of dental school with huge debt, and they have been enticed into going to work for some big corporate offices, and they're told, well, we'll be able to, and I hear these stories from young dentists fairly regularly. You can make X amount of money. We're going to give you, a goal, and if you make more than that, you're going to get a bonus, and all of this. And what winds up happening is, because the fees are so low, which of course the young people don't realize that until they get into the middle of their work. The fees are so low that they have to work like dogs in order to make any money. I talked with a young man several years ago who I met at Pankey, and he worked for 4 years for an office, and he said, I just felt conflicted every day because I felt like I was having to rush in order to meet their production goals, and yet I knew I wasn't taking really good care of people. So that's something that, as we have talked about before, that is out there that I think really is changing the face of dentistry. And I see it every day in my practice when people come in to our office and they've been somewhere where they have not been cared for very well. And it's just really tragic, when you see that happening. Getting back to some of the things that came out in the research that these two men did, there's something called cognitive heuristics. That's HEURISTICS, and biases. It's an approach to problem solving that employs it's a practical method that's not guaranteed to be optimal or perfect, but sufficient to achieve the immediate goal. So a couple of these: overconfidence bias. People have a tendency to be more confident in their own character than is warranted by the facts, which is kind of funny to think about. Self-serving bias, the tendency people have to unconsciously make decisions that serve themselves in a way that an objective third party might look at it and say, nah, I don't think so. Incrementalism, that's that slippery slope that people can get into unintentionally, and then before they know it, they look up and say, how did I wind up here? Framing, people have a tendency to view a situation by minimizing the ethical aspects of it. Denial of responsibility. I shouldn't have done that, but the patient demanded it. The situation that we talked about earlier with the kid that the mother wanted to just pull the tooth. We've all had that situation where we might also justify it by saying, well, somebody's going to do it. So it
Yeah.
might as well be me because I know I'm going to do a better job.
Oh. Mhm.
Denial of injury. I shouldn't have done that, but nobody was hurt. Um, Social waiting. That's another one. I shouldn't have done that, but that's nothing compared to what some other dentists do.
Oh, yes.
And higher loyalties. I shouldn't have done that, but I have a family to feed.
Oh.
Um, that sort of thing.
Yeah.
So one of the things that I think you can do is if you want to be successful, you want to be ethical, you want to please your patients and your boss and your colleagues, but all the while you want to think well of yourself. You want to be able to sleep at night. So it's important to kind of recognize your own rationalizations about things. Start paying attention to that. Just being mindful of it, I think, makes a big difference. And then I also have found that if you think ahead about how to handle these kinds of decisions before they arise, then it's really kind of like having a policy manual. That can be part of it. It was interesting. Our front desk person, when I said no, we're gonna send the check back. We just need to send a letter with it explaining what happened and that we made an error, and we'll deal with the fallout from that, whatever it may be. So, but I said the problem is that would be fraud because we have a date that doesn't match the date when we would be doing the work. So she was a little surprised by that, but she said, "Well, I understand what you're talking about."
Yeah.
So I think it's possible to have a really great team meeting about these kinds of things.
Yes.
Because if you think about it, your team is making decisions, little ones, perhaps all day long about patient care and how they manage things in the office. And it's a great opportunity to talk about situations that come up every day that you can make a decision ahead of time about how you want to do it. It's also fascinating, sometimes in a good, sometimes in a bad way, when you realize how people think about things.
Isn't it?
And you'll see people doing all of these things that I was just talking about, the rationalization. One of the things you can do, the American College of Dentists, which is an organization that really is all about ethics, has a course on ethical dilemmas. They have a bunch of videos, and so you can actually go to their website, which is you can Google American College of Dentists, but and you can download those and look at them with your team. And I've looked at some of those, and they are really, really interesting. And I find myself. I remember one of them that we saw was really about managing sexual harassment in the office from patients, and that of course now with the Me Too movement and all of that has become a more important issue for all of us. It's certainly at the forefront of our minds based on what's going on in the media. But I also think that you can see again some of this rationalization going on with people who have either committed this or have been so-called victim of it, who just didn't think about it being a big deal. Things that are seemingly innocent. So I was talking with a young woman the other day, a hygiene student who is about to go out and start looking for jobs. And so I gave her I was doing a mock interview with her to just help her prepare. We're doing this over at the dental school. So I gave her, for instance, what would you do if a patient came in and was very, very rude or was being sort of suggestive with you? How would you handle that? And it was interesting. One woman she handled it perfectly. The other one said, well, I would tell them I was going to report them. And I said, whoa, stop. let's think about this in a little different way.
Yeah.
So but that's one of those things that I think it's important to talk about as an office. How do you manage those things? It's especially difficult, I think, when you have a male doctor and you have an all-female staff.
Mm-hmm.
So it gets to that presents some interesting dilemmas.
Absolutely. What was the other answer that the other?
Oh, the other answer was, she said, well, I would just let him know that I was a little uncomfortable with what he was doing.
Yeah.
Just to state that.
Yeah.
And I said, and what would you do if it continued? She said, well, I would probably just finish the appointment, but then after it's all over with, I would speak to the doctor about it, and then ask him or let him decide what he wants to do, or her. My approach to that would be to contact the patient and say, I talked to Sally, our hygienist, today, and she was a little uncomfortable about things that went on. And were you aware that what you were doing was making her uncomfortable? And just for future reference, let's not be doing that. So anyway,
good.
So that's how her approach was.
Good. Yeah, I like that. Okay.
Yeah.
All right. That's great.
So one of the things I wanted to move into is talking about patient complaints.
Yes.
About why people leave, and I went online and looked at some things, but I also put together some things that we hear.
Yeah.
And I'm sure these are things that other people hear as new patients come into their offices.
Yeah.
Not being too rough, not being very gentle in my mouth.
Yep.
Felt like she was incompetent. Always seems to be in a hurry. He was arrogant. Yeah. Unfriendly staff, high staff turnover. They were always trying to upsell me. They really didn't take the time to explain anything. And I felt like I was paying for the expensive decor and equipment, but not for good care. They didn't really respond to my complaints or concerns. They didn't seem to care that I was having a problem. And so really, I think a lot of us think that the reason that people leave is because of fees or location or, their insurance. And we certainly hear that as an excuse. But the people who have really done some surveys about this maintain that the real reasons that people leave the dental practice is because of their experiences in the office.
Yeah, that's right.
And so it's interesting to me that we have kind of two rules in dentistry. Two overarching rules is first, do no harm. And then the other is what's in the patient's best interest. And yet, we have people filing complaints against dentists at the state board. We have our local dental society has a peer review program, and we have people do that. Thankfully, because that certainly avoids lawsuits.
Right.
But why? What happens? Why does this occur? And some of this is definitely related to ethical decisions that people make. But you can have really good intentions and bad results. This stuff happens. Rationale, poor diagnosis or execution of treatment. An unskilled or inexperienced dentist, maybe a lazy or incomplete evaluation, and then greed. Some people see a patient as a financial opportunity. And here again, this really speaks to ethics, and certainly, what's in the best interest of the patient is not always what winds up happening.
That's so true.
Yeah. And so, of course, we're trying to run a small business and take care of people and meet our production and our time goals and try to maintain our overhead. It gets to be really tough. There's a whole lot of challenges to that.
It really does.
And then we have people, as I mentioned earlier, it really worries me how the debt level that our students have. I've heard a variety of figures. If you just occasionally when I've been over at the school and in a room full of people, I'll just ask, what do you anticipate your debt being? And a lot of these folks are looking at $200,000 and $300,000.
Yeah.
I've heard even higher figures than that.
Oh yeah.
We really try to encourage people not to think about. Well, sometimes I think what happens is people get in a situation of assuming. And certainly if they've been paying attention, and a lot of the corporate offices are at the dental schools a lot sponsoring things, and they kind of give students the impression that, oh, you're going to make a lot of money when you get out, you can do this and that, guaranteed salaries and bonuses, signing bonuses, and et cetera, et cetera. So they start thinking, hey, I can borrow this money and it's a low interest rate and I'm going to be fine. Mm-hmm. But the reality sets in once they start into practice. And I think what concerns me as a private practice office is that it is changing the face of dentistry. Yeah. And when I talk to people at the school, the professors at the school, they worry because they feel like these students are not going to be in a position to be able to buy into a private practice because they're so far in debt that they can't add to it with a loan. Yeah. And that's a real problem. It really is.
That's right. Mm-hmm.
So one of the things that I really encourage students when I am talking to them is to look at money or happiness, frankly. Yeah. What is going to, I don't think they often realize the stress levels that they're going to be under, trying to learn how to practice, trying to learn how to do dentistry and meet somebody else's expectations of their financial and time goals. They've got you set on a schedule, and by golly, you've got X amount of time to get this done, and you better do it.
Right.
So I have an associate, and she's told me that her last office that she was in, they timed her on all of her procedures.
Wow. Mm-hmm.
And we have done time studies in our office, but the purpose of it was to, it was kind of interesting to find out, really, it took me that long to do that?
Yeah, it is good to know. Mm-hmm.
Yeah, and we did it strictly for, to be able to schedule appropriately, but what was happening with her, it was all about, you need to do this faster.
Yeah. Mm-hmm.
So, which worries me. That gets into an ethical decision about, am I going to, if this patient's going to take more time in order to be able to do the job appropriately, how am I going to handle that? That's an ethical question. Mm-hmm. It really is.
Yeah. Mm-hmm. Exactly.
So, one of the things that I have learned over the years is that, years ago I remember having a patient come to see me. And I had been an associate, and she had been a patient of the doctor who owned the practice. And then about, 5 years later, after I'd left, she shows up in my office, and I said, why are you here? And she said, well, because every time Dr. So-and-so saw me, I saw dollar signs in his eyes.
Oh.
And so one of the things that I ask young doctors, or doctors anywhere really, is, so what happens when your patients witness or experience you looking in their mouths? Do they see dollar signs in your eyes?
Yeah.
They may imagine it because they realize they need to have a lot of work done. It's going to be expensive. But I think your approach to that begins with, frankly, your personal finances. Mm-hmm. And one of the things that I learned when I was going through the Pankey Institute as a student was the importance of controlling our personal finances and our personal debt and of having savings, because when you are in debt up to your eyeballs and you are depending on that practice to support that, and you are depending, take it to the next level for each one of those patients to support that, it puts you in a completely different situation. And I remember there were several of my teachers at Pankey who talked about, it was interesting, when I needed the money, nobody said yes. When I quit needing the money, everybody said yes.
Isn't that something?
It just colors your approach to patients,
and
they can tell they have they have that detector.
Yes,
They
do.
can really tell. So our tendency sometimes is to think, oh, I've got to have all this fancy equipment because I've got to look like and certainly all of the technical things that we can do now in our offices makes it very compelling to buy this, buy that, thinking, well, patients are going to be very impressed. But then the reality sets in of how much that stuff costs and how much dentistry we have to sell, quotes, in order to pay for that equipment. Right. So that's another place where ethics can come into play that you may not be thinking about it that way.
That's right.
So it's important to be careful. I think about your personal finances as well as your practice.
That's exactly right. It does have a bearing for sure.
Yep, it really does. And one of the things you and I've talked about this, Paula, that has really made a big difference for me in my office is several years ago we began doing we created an office savings account. Yep. And every week $1,000 is deposited into that savings account. So if you think about it, you're automatically at the end of the year going to have $52,000 sitting there. Yeah. And the purpose of that is to allow us to have money if we have a slow month, if I go on vacation, if whatever it might be, if you have a slow month, you don't worry because you know that money is sitting there available to you to use. Or you want to buy a small piece of equipment, you don't want to borrow the money or do or any of those kinds of things. Just there's the money, you can do it. So I encourage that sort of thing. I think savings personally and in your practice is huge for allowing you to make really great ethical decisions for your patients because that money issue is just not there. So
that's so true. That is such a great plan to save, and you can also let the team know, hey, this is so you get paid.
Right. That you are exactly right about that, and that makes a gigantic difference. So my team always knows we've never missed payroll. We've never. It was never even a question about it. So my bookkeeper knows. It's been a slow month. I moved $10,000 or something. So that really does make a big, big difference.
It takes a relief off your mind. It really does.
It really does. So the last topic is how do you develop a practice that attracts and retains patients? And along with ethics comes trust.
Yes.
And trust is huge, and all of those things that I talked about earlier that happened in dental practices that people come in complaining about, if you go back and look at it, it really is about trust. They didn't feel like they didn't trust the dentist or the team to be able to take care of them and have their best interests at heart. Yep. So some of this is, in my practice, one of the things I really have enjoyed, and I certainly learned this at Pankey, and Pankey is, the focus is on it's on comprehensive care, it's on technical skills, it's on relationships. Yeah. And that makes a big difference in how we've been able to practice. Yes. We have the time, we take the time to get to know our patients. And it's interesting to me. I think when you are working in that kind of practice where you value those people, you value the relationship, it also enhances your ability to make ethical decisions, good decisions for people because you care about them.
Yes. Yes. That's right.
So that's really critical, I think, and it really has been a godsend for us. I've been practicing for 38 years, and we've been paying attention recently when old patients come in, and I saw a guy yesterday that's been in my practice since I was a baby dentist.
Yeah.
I graduated in 81, and he became our patient in 1982.
Aww.
So, and I love that, and I love seeing these folks come in. They've been with us for decades, and it's like family. It really is.
Dr. Owen, I really love what you just shared. This is so important for everyone to consider. And I know you and I've talked about this for a couple of years now, and I have heard your husband's a little bit of the talk, or read it. I think he put it on Facebook.
Yeah.
And I thought it was excellent, especially for attorneys as well. I mean, every profession has this challenge.
They do.
So, give us a little background on you, where you came from, how you got into dentistry, and why you've stayed in it so long.
Well, I actually graduated with a degree in journalism and got married to a guy who was going to dental school. And while he was in dental school, the job that I found was in public health. It was there. That was in '71, and I wound up, even though it was not my plan, it was sort of the path that I took because it's what was available to me. I couldn't get a job working for a newspaper because I was a newbie, and in a big city in Houston, and so I was their public information officer, and I got a master's in public health while I was doing that. And then I decided, no, this isn't really what how I thought my journalism degree or my career would pan out. But I had always been interested in healthcare, and I thought, well, maybe medical school. Maybe I should think about that. So I went over and talked to the folks at the medical school, and they told me what I needed to take in order to apply, and it was daunting. It was all the math and science that I didn't have.
Oh, yeah.
So I at night I went out to University of Houston, and it took me about 3 years, and then I started thinking about applying to schools. Well, my husband at the time was by this time he'd graduated from dental school. He was in his first year of oral surgery residency. And he said, why are you so focused on medicine? Why don't you think about dentistry? You've always been good with your hands.
Yeah.
People don't die on you. You can have a family and, you can control your hours and your life. And I thought, well, he may be right. So I applied. I took the DAT and did pretty well. And
awesome.
And I got accepted. And of course, then a few months later, he said, see ya, because he was interested in somebody else. But, but that's a whole nother story. And actually, so I credit him with encouraging me to go to dental school and then leaving, which paved the way for me to meet my current husband, who is wonderful.
Yeah.
So I graduated in '81. I was actually an associate for about 14 years in 2 different practices, and then went to Pankey in '94, and that was really a game changer for me. And it gave me a template for how to structure a practice.
Yeah. And
so I in '95, I set up I moved out from the dentist I was practicing with and started my own office, and never looked back. Yeah. And I am very fortunate because I grew up in those 2 practices where I was an associate. Never participated in any plans, and I never have participated in any plans. We do work with traditional insurance, and we do file for people electronically, and really try to make that path as smooth as possible for them, but I have never participated in any plans. And based on my experiences that I've had with my friends who have done that, it's very difficult getting off those plans. So I've never thought, no, we're managing okay without it. And but my focus is on restorative dentistry. I refer out, we don't do little children, ortho, perio surgery, endo, any of that. So, and I have, we focus on TMD issues and occlusion and restorative, and I really enjoy what I do. And now that we're beginning to, in dentistry, move into more integrative types of care with looking at medicine and sleep and all that. Yeah. Wow. I mean, I just turned 69, and I'm still gung-ho and having fun every day. And
you're awesome. You're an inspiration. You're never sick. You run. You're
Yeah.
active outside. You have an awesome family, and you just are so caring, and you love your team. You've had your
Yeah.
team with you a long time, and you really believe in personal growth, and you're just all those things that
Well, thank you,
people
Paula.
want to be.
Well, and you've encouraged me as my coach, so thank you so much for
It's
your
a pleasure.
influence in my life. It's been great.
Yeah, well, thank you. It's been a pleasure and a blessing to me, and you've taught me a lot as well. So
Well,
it's
thanks.
a mutual
Thank you.
beneficial relationship. Dr. Owen, is there your website you want to share or anything? If someone wants to contact you and maybe ask you to come speak, I don't know if I'm just throwing that out there. I don't even know if you want to, but
Sure.
I think this is an excellent topic to be covered. So,
well, thank you.
how can they contact you?
I will give you two things. My personal email address,
Okay.
which is dr.owen,
Okay.
dr.owen at owendds.com.
Okay.
And my office phone is 713
Mm-hmm.
622
Mm-hmm.
2248.
Okay, gotcha. Awesome. Well, again, thank you so much for doing this for our doctors who are listening today, and maybe some team members will be listening too. I think it'd be a great thing to share with the team. And I know that you're having an impact out there, and I hope this takes it a little further.
Thank you so much, Paula.
All right. Thanks, everybody. Bye-bye.